what's the difference between this injection, and this injection? So all three of those injections are very similar, and all injectors will occasionally inject in these areas, but they are wildly different in terms of the impact that they have on your patient's aesthetic. So it's a great way to understand the anatomy, to break down how these different injections can affect the result. Let's have a look at each area, and I'll explain why there are side effects, complications, and risks, as well as benefits of treating in each of these different areas of the face. This is the most common area that we are injecting when using botulinum toxins. So when you start to understand the big impacts that small movements in your needle make with the end result, you become a really wise injector. I always say the difference between someone who's well-trained and someone who isn't well-trained is a badly trained person knows where to inject, whereas a really good injector knows what the result is when they inject in a slightly different place. So it's about understanding the impact wherever you inject, and that makes you more likely to inject accurately. So let's have a look at this first injection point, which I put about here. The point I chose first was above the insertion point of the corrugator muscle. Now, this corrugator muscle insertion point is often confused with a bunching that happens above that muscle. If you have a look at someone who's frowning strongly, you will often get a bunching of the tissue above the insertion point of corrugator. And this bulge looks a little bit like the bulge of a muscle belly. And many injectors, or even a few YouTube videos I found where the trainer is telling people to inject here. Now, unfortunately, this is the frontalis muscle. And what you will do if you inject the frontalis muscle here with a hefty dose or even a light dose is cause a medial brow drop. It's right in the area where we need brow elevation all across the forehead. So this area might improve horizontal forehead lines, but it's also going to cause a medial brow drop in a high percentage of patients. So if you then move down about 5 to 8 millimeters, you should now be in the insertion point. Now, corrugator muscle inserts directly into the dermis, and you should see this on the surface of your untreated patient's skin. They should have a little dent that forms. It's usually just above the midpupillary line or slightly lateral to it. And as they frown, they get a little shadow just here and a couple of little boomerang-shaped creases. This is a great place to place toxin in the tail of the corrugator to decrease lines and wrinkles. And because you are being so accurate, you should not affect the frontalis muscle or the orbicularis oculi muscle. I tend to use a lower dose here of 1 to 2 units. The next point we talked about is just 5 to 8 millimeters lower down. And now you can see we are in the orbicularis oculi muscle. Now, this muscle is often treated when we're trying to lift the eyebrow. Most commonly, we get the best benefit for lifting an eyebrow laterally, but you can treat more medially and you can get a little bit of a lift. The only problem is when you go too deep. If you go too deep in this area, you're no longer treating the orbicularis oculi muscle. You've passed through that, through the orbital membrane, and you're directly into the zone where the levator pulpary muscle resides, within the orbit. And this is actually used by ophthalmologists to decrease someone whose eyelids are too wide open. So it is the injection point to cause an eyelid ptosis. And it's all about depth, because you can inject here if you're superficial enough, although it's higher risk for sure. If you're very, very superficial, it's pretty safe. Whereas here, once you go beyond a certain depth, you're guaranteed to get an effect on the eyelid muscles. So I've just had a good question from my videographer, David, which is how do you actually know, because all faces are so different, whether you're safe or not? And this really does come down to understanding the core principles of anatomy, but then knowing how to apply it to unique faces. So every face will give you clues as to the exact anatomy for that patient, most important of which will be the insertion points of the muscle and then the position of the crease that follows on from that muscle. So for example, if you're looking at someone's corrugator and you're trying to inject it very accurately without affecting the frontalis or the orbicularis oculi, you can get the patient to contract those muscles. So as your eyebrows are raised up, you can see where the frontalis muscle is. As you then contract the corrugator muscle, you should see the direction of pull and the most lateral little creases where that tail is inserted into the dermis. And then when they contract orbicularis oculi, you can also see where that muscle is most active. So as you study the face, you're relating it to that individual and doing precise injection points to help that individual patient based on broad anatomical principles. So I hope that's helped you understand how small differences in injection points can make big differences to patients. If you'd like to learn more about anatomy and botulinum toxin, as well as a whole lot more, make sure you sign up to the waiting list for my new movement. It's not open yet, but we'll let you know when it is.